President Donald Trump is back in the White House, and he said he's feeling better than ever. But top doctors say it's important to note that the president has received treatment that most Americans do not have access to or cannot afford, including steroids and antibody therapy. Joining me to talk about that is Dr. Fahmi Farah, a cardiologist based in Fort Worth. Welcome.
Thank you for having me. It's a pleasure to be here.
Of course, a lot of talk on everything that is happening right now with the president still infected with COVID-19, possibly still contagious as well. But what is the antibody cocktail that the president received?
So it is a monoclonal antibody. It is a trial medicine right now. It is an experimental drug. It was from the Regeneron company. We know very little about it. It's supposed to behave and act very similarly to convalescent plasma. The difference between convalescent plasma and this is that it has specific type of antibody as opposed to convalescent plasma that has many types of antibodies. So what the company is suggesting is that this is supposed to reduce the viral load as well as the symptoms during the acute phase in non-hospitalized patients. But again, this is not a proven medicine yet. It is still in the trial phase. It is very much an experimental drug, so we honestly don't know whether it is efficacious. If it actually works, we have yet to see, and it has yet to be approved.
So, Dr. Fahmi, what treatment is available for the normal person that gets COVID?
So for COVID, primarily the biggest treatment we have is supportive care. There is no proven treatment for COVID yet. In the hospital setting for patients who are very sick with infection, COVID-19 infection, we are using remdesivir. Remdesivir, again, is not given to every patient who is infected with COVID, and even those who are hospitalized, it's not given to everyone. It's only reserved for very ill patients. We also use convalescent plasma, as I mentioned earlier, that is also reserved for very sick patients, typically critically ill patients who are in the ICU or are ventilated. We also used steroid, something that you've heard of recently in the news that was used on the president. Steroid is not something that we use on everybody. It is also reserved for very acutely ill patients with COVID infection, typically actually for people who are ventilated or are requiring high level of supportive care in terms of breathing and lung infection.
Dr. Fahmi, before we go here, we've seen the videos that the president has tweeted pretty much saying, hey, he's feeling good and kind of downplaying coronavirus. And there's also issues with the whole mask wearing. What is your message to people watching right now?
Well, first of all, I'm very happy that the president is presumably doing better and well, but the message should not be downplaying regarding COVID. My message is very simple and clear. We are in a very serious pandemic. This virus is extremely contagious. We are still fighting it. There is no cure, no treatment that's been proven yet. So it is absolutely crucial that we continue with our precaution measures, that we wear our masks in public, that we continue to maintain social distance and washing hands, maintaining good health, good immune health with a healthy diet and exercise. So all of those we must continue. We should not be downplaying this virus.
You're right, Dr. Fahmi Farah. Thank you so much for joining us this midday. Great information.
Thank you so much for having me. It was a pleasure.
Of course.